Heard chamomile tea can alleviate the symptoms of fibromyalgia. Is that true?
There's no direct evidence that chamomile tea works to help fibromyalgia, but it can relax you and help you feel ready for sleep. I'm not talking about fibromyalgia. I don't want you wasting your time or your money anymore going from doctor to doctor to get the diagnosis that you need. Dr. Dottle, help us with this. What is the kind of doctor folks are going to be looking for advice from in order to make this diagnosis correctly?
Sure. I think it's a great way to start out with your primary care physician. That can be your family doctor, that can be your internist, but you might need a specialist, in which case you might see a rheumatologist. Now, a rheumatologist is a specialist who really focuses on musculoskeletal diseases as well as many others, and they often see lots of fibromyalgia patients, so this is a great place to go. We also think that neurologists might be a great place to go as well, because now we're learning so much more about how fibromyalgia affects the brain.
So rheumatologists and neurologists, the two specialists you should all ask for if you're pecking for the right diagnosis. All right, let's get the treatment.
Sure.
We know there are 3 FDA-approved medications that can help fibromyalgia symptoms, but you brought a unique therapy today that I adore. It's called osteopathic manipulative treatment. And Dr. Martin Levine is joining us. He's an osteopathic physician who uses these practices in his practice. So teach us a little bit, who would this be appropriate for? I'm sorry, Carol?
Yes.
Thanks for being the guinea pig today, Carol.
So osteopathic manipulative treatment is performed by osteopathic physicians. It's really a way that physicians are able to diagnose and treat musculoskeletal problems with our hands. And really the idea is we're trying to help the body, the patient's body, heal itself. So Dr. Levine here, one of the things that he was doing initially was feeling for muscle spasms in our patient's neck, and he's now stretching out the neck muscles to kind of relieve some of those muscle spasms. Now, it's important to remember that OMT, or osteopathic manipulative therapy, treatment is fantastic for fibro patients. But there are other treatment options, meditation, yoga, cognitive behavioral therapy, etc. But this is one great option.
And ideally, who benefits the most from these treatments?
Most fibro patients will benefit from it. If you're concerned about whether this is a good option for you, make sure you speak with your osteopathic physician about that. But most patients can really tolerate OMT very well and actually be very successful. Dr. Levine now is doing a structural exam on our patient's back, looking for other muscle spasms. And now one of the things he's going to do is he'll lie our patient on her back. And this maneuver really is an attempt to restore the patient's body movements and joints back to their normal range of motion.
Oh, I hear the cracking. I like that. I hope Carol's okay under there. Stop moaning and groaning, Carol. It builds character.
And so this is one of the treatments that he routinely performs, as many osteopathic physicians do. This is great for a lot of pain conditions. OMT can be used for things other than fibromyalgia. So other chronic pain conditions, headache, arthritis, low back pain, you name it. But this is a great option.
How you doing? You okay in there? I'm You keep working here. Let Carol enjoy this. It actually does look very helpful. I've actually referred patients for this.
Wonderful.
And I think this type of osteopathic manipulations are worth considering as an alternative, especially for conditions like fibromyalgia.
Absolutely.
So let me speak to everybody about this for a second. If you're experiencing some of the symptoms we have talked about today, we have put a quiz online to help you decide whether you are at risk. You can go to droz.com and take that quiz. Now listen, I know fibromyalgia is a hot button issue for you. So our experts will be answering your fibromyalgia questions. Tweet me at #OzAnswers. You'll be able to help be part of that conversation. Coming up next, the thing you need to take in order to get 5 years off your face and look younger. Find out what it is.
Dr. Oz